I'm Dr. Ethan Handler, and I'll be speaking today regarding sleep. So sleep problems, this first slide is just kind of discussing an interview here. And so the problem, over 50% of the US population snores. 1 in 10 people have actual sleep apnea. And honestly, that number is probably larger than that. It's just the diagnosis of sleep apnea isn't always thought of out the gates. The percentage of people that have sleep apnea does increase with weight. Sleep apnea has negative effects on the body, negative effects on the mind, and can affect the entire household, not just the person that has sleep apnea themselves. So many people don't actually ask the question, do I have a sleep problem? They may know they do, they may feel like they do, but they don't actually want to know the answer because they worry that what the treatment's going to be is a CPAP machine. And so at Advent, we want to stress that CPAP is not always the answer, and oftentimes it's not the answer. It's an answer, but it's not the only one. The compliance rates for CPAP machines on a national average are about 33%. Now, when you think about like a treatment in medicine, like a success rate, if you said 33% is going to be your success rate, would you ever have anything done? And the answer is no. And so, at Advent, we strive to push that number higher, and we've found a way to do that. And our trailing average for CPAP compliance is approximately 78%. And so at Advent, compliance is our goal. And so we make an effort to put our best foot forward and help you put your best foot forward so that you can tolerate a CPAP machine if that's what you choose, or to find a different option. So the real first question is, do I have sleep apnea? And I think that, unless a physician, whether it's a primary care or, ER doctor or neurologist, unless they're thinking about sleep apnea in the back of their mind, they won't actually ask that question and get you a sleep study. And so patients often hear about the danger, but it's often overlooked at their primary care office. It's also very poorly explained. When people hear sleep apnea, they worry about a CPAP machine. And so again, it's poorly explained. And oftentimes they're told the mask is the only option. So in obstructed sleep, this diagram shows obstruction. And so what happens now this patient's on their back, but what happens typically is you get collapse of the airway. And this is typically below the nasal passageway. And so you have the tongue that can flop back and the palate that can flop back and the throat that collapses in. And this is what causes people to have these breath holding spells or have their oxygen level in their blood decrease, which are all, potentially dangerous events. So it's also important to understand that the range of sleep disordered breathing is on a spectrum. Okay, and so you have normal breathing on one side that you see here in the green, you have severe sleep apnea on the other side, and then there's all these things that are in between. There are lots of patients that come to Advent that are being brought in by their significant other or kids or whoever, because they have snoring problems. And oftentimes snoring can be just snoring, but most often it's wrapped up into some sort of, sleep disordered breathing, which could be actual sleep apnea. And so the barrier to test for sleep apnea has gotten so low, meaning that you don't have to go off to a lab and sleep in some weird bed with all these cords attached to you. You honestly can have a small device that you wear on your forehead, which we'll show pictures of, and sleep in your own bed. And then we can answer that question, do I have sleep apnea? And so that leads us to our next slide. Do I have this? And so, typically if you have snoring, people wake up with dry mouth. And so dry mouth is a tall tale sign that you have been mouth breathing. And usually it can be because, one, your nose is not working. And so noses have to function. You have to breathe through your nose at night. And so if you have water by the bedside or, cotton mouth in the morning, that's usually a good sign that you're not nose breathing, that you're mouth breathing. It also increases your chance of having sleep apnea. Things that that people don't typically think about, decreased libido or erectile dysfunction, and that's obviously a big deal. And so sleep apnea can be a cause for that. Also high blood pressure. And when I say high blood pressure, not only does sleep apnea, meaning those events where you're not breathing, put a lot of strain on your heart, but it actually makes controlling high blood pressure harder. And so there are some patients out there, and you may be one of them, that that are on multiple blood pressure medications. And if you have sleep apnea, that can be the culprit as to why you need multiple medications to control that blood pressure. People that have diabetes, same thing. So, again, it's putting a lot of strain on the heart. Diabetes can be harder to control. And then there's kind of the daytime issues, and so people who are tired, if you're at work and you want to take a nap around noon or when you get home, headaches. This is a big one. And so a lot of people complain of headaches, and obviously headaches can be caused by a lot of different things. But I always think of sleep apnea in my mind, like, hey, let's test it. Let's make sure you don't have this. Let's make sure it's not contributing to your headache issue. And then of course, heart attack and strokes. And this is kind of what I describe as, if you have sleep apnea and it's kind of like holding a grenade, the pin's pulled, you may never let go, but you might, and the chance of you letting go is higher than the person out there that doesn't have sleep apnea, and being in Wisconsin, and I have lots of patients talk about Reggie White, and he died from sleep apnea. Well, he didn't die from sleep apnea per se, but he died from a complication related to it, which was, as far as heart attacks and strokes. So why should you be treated? There are multiple reasons, and we kind of touched on the previous slide, but hey, it's a quality of life issue. You can't be your best when you're tired. That's both mentally, physically, and emotionally. You have an increased risk for heart attack, strokes, erectile dysfunction, high blood pressure, which kind of loops back into that stroke and heart attack issue, and then diabetes. And then in general, you're less productive. When you're tired, you don't feel like working. When you're tired, you don't feel like working out. When you're tired, you don't feel like spending time with family. And it's crucial and required to treat in certain professions. So truck drivers, if you have a CDL license, it's required that you treat that. And again, CPAP is not the only option. If there's anything that you should learn from this presentation is that it's an option, but it's not the only option. So I think this is really the take home. Advent knows when you breathe well, you live better. And that starts with breathing through the nose and then treating underlying conditions beneath that in the mouth and the throat, which we are positioned well to do for you. So the first step is evaluate. And so there's this concept that we have called the breathing triangle. And the idea is that you have basically 3 holes that you can breathe through, okay? 2 nostrils and a mouth. Now, as I mentioned before, your mouth's not for breathing. There's an adage that you should breathe through your mouth as much as you eat through your nose, okay? And so the mouth is for talking, the mouth is for eating, but it's not for breathing. And so it's critical to establish the proper care plan, which is in the evaluation of these areas. Typically at that first visit, we will assess your nose and throat with a tiny little camera. It's called a flexible scope. But this is essential to really look at all the anatomy. Next, as we talked about, an at-home sleep study. So again, I've never had a patient, when I've asked the question, hey, how many of you have loved your night's sleep at a sleep lab? No one's ever raised their hand, And so it's such a weird concept and such a weird experience that nobody enjoys it. Nobody ever feels like it's representative of their night's sleep. And so these devices are easy to be worn, easy to use, comfortable for the most part. Again, you have something on your head, but this is a lot less cumbersome than going to a sleep lab. And it gives us pretty much all the data that we need. The other part of evaluation is an in-office CT scan. And so this is really important because I can't tell you what your nose breathing's like unless I get a full view with imaging of your sinuses and your nasal passageways. Again, that scope helps me look at the anatomy inside the nose, and then the CT scan will give me the full picture of sinuses, make sure that there's not some obstruction or issue there. We then can review those results of that CT scan with you immediately. This is done in the office, and then you see the surgeon that same day. Again, this is essential to kind of creating your personal care plan and figuring out how do we get the nose working first, and then treat the airway issues below that. The next step is breathing. And so most people out there suffer from nasal congestion problems, suffer from facial pressure, just don't feel like their nose works. Some people call it restriction, some people call it plugging, some people call it pressure. And you're left with trying to figure out what to do because most people have been to a primary care or tried to read online or something like that to figure out how to improve their facial pressure and nasal congestion issues. And so you're left to walk into a Walgreens or CVS and go down that aisle with all those treatments for colds and things and try to figure out what combination works for you. And many people have their Zyrtec and their Sudafed and then their Mucinex and all these things that they use in combination to try and just get them as optimized as they can be. When the reality is the underlying problem is an anatomical one. It can be fixed relatively easily in clinic, in a procedure. And so, sprays can work, but they work a lot better when your nose is open. The other concept here is allergy testing and treatment. And so I can't change the lining inside your nose, meaning that you are who you are and you react to the world around you. This is why allergy testing is important. But I can get it so that those sprays can work a lot better in your nose so that if I get you open with a procedure, then you use sprays and it's even better. So one of the things that really separates Advent from all the other ENTs around our community and honestly in the nation is our office-based treatments. And so with nasal procedures, the importance here is that getting your nose working improves every other treatment option. So as I talk to patients and I say, okay, you have sleep apnea, and we want to get that fixed because you have all these long-term risks that we talked about. And I say, getting your nose working has two important points. One, quality of life. Breathing through your nose is the way you should breathe. It feels good. You will feel better. Two, it helps put your best foot forward to allow you to better tolerate treatments for sleep apnea. And we'll get into what those two treatments are, but conservatively, it's typically either a CPAP machine or it's an oral appliance, and we'll get into what that is. But essentially, getting your nose working helps make all those other things work better. It improves sleep quality. It allows your body to use the most effective and efficient airway. Again, your nose is your primary airway. You should use it well day and night. So getting your nose working can improve snoring. And so, I never try to paint the picture of snoring that, we can cure it, because nobody can. The reality is snoring is one of these things that can ebb and flow whether you're on your back or side, but it's about, can we get it to a point where it's not bothering the person next to you or other people in the house, not waking you up? And so getting you breathing through your nose at night typically helps make that better, maybe makes it quiet. Whereas then the snoring that's kind of wrapped up in your sleep apnea, when we treat that, the snoring will hopefully improve and get over the goal line. Nasal procedures also are not in itself a cure for sleep apnea, and I want to make sure that I hit that point home, is that at Advent, we aren't touting that if I get your nose working, your sleep apnea disappears. What it does is, again, getting your nose working improves quality of life and puts your best foot forward to better tolerate those treatment options. There might be some of you out there that are listening and watching this that have already been on a CPAP machine or have tried these other options and can't tolerate them. And one of the reasons is because nobody's ever asked you if your nose works or got your nose working. And so that's a big reason why people can't tolerate CPAP machines, is because their nose is congested. So one of the office procedures that we do is called in-office balloon sinuplasty. And so the concept here is that I have a little guide wire that I can sneak into the sinuses in the forehead, in the cheeks, and even in the back of the nose. And this balloon is rigid when it inflates and enlarges that natural inflow and outflow passageway of those sinuses. What that does is it restores normal sinus drainage and function. And the point is better airflow into sinuses, so you're ventilating better mucus flow out. This can help with congestion, this can help with facial pressure pain, this can help with sinus infections. The advantage of doing things in the office is that bleeding and discomfort's minimal and you're back to your normal life, I always say, within about 0 to 2 days. Some people don't skip a beat, some people take a day off, but you're not on pain medication other than Tylenol or something if you need it, but we don't prescribe opiates, we just don't need to. People do very well. The other essential part to what we do in the office is turbinate reduction. And this is where I take a heat wand. It uses radio frequency. You can see it here in the bottom right-hand picture. But basically that wand shrinks that turbinate tissue down, as you can see in the diagram. And that really opens up the main tunnel of the airway. So I can't get airflow to sinuses if your turbinates are in the way. And so these two things work in tandem to get you breathing as well as we can in the office. The other thing I want to mention about office treatments is it takes about 15 minutes or so. You're numb for about 30 minutes before that procedure. Again, the procedure about 15 minutes. It combines those two elements that I described. So turbinate reduction, in-office procedures. You're here for about 15 minutes or so after with some cotton in your nose. That cotton comes out, you go home. Patients drive themselves. Sometimes patients want to take a pre-medication, which is not a problem. We let you decide if that's something you want. We can prescribe that for you. Basically makes you care a lot less about what's going on. But otherwise, being awake for the procedure is an advantage, again, because it's better from a recovery standpoint. We talk you through everything as we go. There's weirdness to it, but most people do just fine. And the weirdness is just because it's not something you ever had done before. But again, I think most people are pleasantly surprised on the back end of the procedure saying, hey, that's not as bad as I thought it was going to be in my head. Next option, surgical treatment. So there are some patients who may not be great candidates for office-based procedures. Sometimes their insurance doesn't cover it. Fortunately, that's rare. Other times, though, patients just don't want to be awake for something, or there's something that we see in that CT scan that we think that, hey, we just can't get you as good as we want you to be and need you to be in the office. And so surgical treatment is certainly an option. This is done at a surgery center. It's an outpatient surgery, so you come, you leave the same day. It is done with you asleep. But the advantage here is that, hey, we can be, you can swing the bat a little bit harder when you go to the operating room. And so it's still a very, very, very good option. So in the operating room, there's basically three parts that we address. One is endoscopic sinus surgery. So what is that? Well, that's me taking a little telescope and I'm looking through your nostrils, so there's no cuts outside the nose, there's no black and blue eyes. And it allows me to kind of clear out the sinuses. And so, one concept is, with the balloon, I basically widen the door as much as I can. In the operating room, we make it a double wide door. So it's just enlarging kind of those natural passageways and making them bigger than the balloons might do in the clinic. The next step also that we address is septoplasty. So if I'm taking to the operating room, the mindset for the surgeons here at Advent is whatever venue we do something, meaning if it's in the office or in the operating room, I'm going to get you as good as I can in that setting. And so septum is often done in the operating room because, I'm going to get you as much airway as I can. I'm going to make that thing nice and straight. Again, incisions are made inside the nose, so it's not any cuts externally on the outside of the body. Even doing a septoplasty, it's not the black and blue eyes and things. Next up is sleep. And so for sleep, really the only medical management, I guess, is weight loss. Now the problem is, it's really hard to lose weight when you're not sleeping well. It's hard to lose weight when you have sleep apnea and you're not treating it effectively. And so I think at Advent we understand that, hey, weight loss is a great goal, but we need to get you sleeping better. We need to get your sleep apnea under control. And then when you have the energy, if you lose weight, you may not need any of those things that you had. You may not need that CPAP machine anymore. And we can always retest with that at-home sleep study and see if your sleep apnea has gone away. The other option, as we discussed before, and this is obviously what people hear about often, is the CPAP machine. And so this is basically a device that sits on the face and it pumps air through a hose into the nose and or mouth. There's different types of masks, and basically helps open the airway with this airflow. As I mentioned before, the problem with CPAP is that 70% of patients do not use it. And so it's pointless if it's sitting in your nightstand or in your closet. And obviously, if you're not getting the rest that you need, what's the point of having a CPAP machine? One of the reasons we discuss for non-compliance with this machine is, as I mentioned, if your nose is congested, this machine has to force more air in through your nose and mouth because your nose is tight. And so as that pressure ramps up, the chance of you using it declines rapidly. And then there's just the weirdness of wearing a machine, honestly. I mean, it's a strange concept. Obviously it works, but if it's not worn, it's not working for you. The other option is an oral appliance. And honestly, there's a lot of patients who, one, didn't know that this existed, and two, didn't know that it's FDA approved for sleep apnea, and it works really well. And so a custom appliance is the one that is the best. There are semi-custom that you can buy on Amazon and online, and you heat mold them, and they're big and they're bulky and they cause a lot of discomfort. Ones that are custom made fit better, they fit for your mouth, and it works by keeping your jaw forward, and with jaw comes tongue that opens airway. The important part of having an oral appliance is that you need to have your mouth closed with this in place, and that's how this is going to work. It's best for you. And so if your nose is not working at night, you're not breathing through it, there's no way you're going to keep this in your mouth. So office-based procedures when it comes to treatment for sleep apnea specifically, are typically geared towards stiffening that palate. And so in the back of the throat, if you open your mouth and you look back there and there's a little dangly thing back there, that's called the uvula. And so again, most treatments are geared towards how do I stiffen that tissue so it's not flopping around like a windsock. And that can help with primary snoring and then real mild sleep apnea. 80% effective in patients who are properly selected. And I want to just pound that point home is that this is not a treatment for all comers. It has to be in very select patients who don't have a big tongue that's taking up a lot of space in their mouth, that have a real long hanging soft palate, and that's who treatments are geared towards. So we do something called snoroplasty, and this is typically where we inject some chemical that helps cause scarring into the soft palate. And scarring is good. Scarring is what stiffens that tissue. Also, we have the ability to trim that uvula in clinic as well. And so again, it's geared towards trying to stiffen that soft tissue in the back of the throat. Another option is a pillar procedure. And so this is not done as commonly anymore. I think that at Advent we have had better success doing other things. The concept of pillar implants are that it's trying to, again, stiffen that tissue back there. It's just that we have noticed some issues with some of those pillars wanting to extrude and just feel like it hasn't been the most successful for us here at Advent. So the other options are actual surgical treatments. And so a lot of people have maybe heard of this UPP. And so this is a procedure where in the operating room, you can actually remove tonsils if they're taking up a lot of space and then trim soft palate as well and trying to create more space in the back of the throat. this is a real big swing of the bat. And so it's typically in our algorithm, the way we think about things is this is a last resort option because it's the most painful and it has the longest recovery. And so a lot of patients don't need this or never get to this stage because they don't need to. We get them treated by getting their nose working first and then either getting an oral appliance in their mouth or getting a CPAP machine in place. The other surgical potential is for base of tongue reduction. And so this is kind of the, a big amount of the tongue you never see. It sits back down inside the throat, and that's what tends to flop back. And so you can reduce that tissue using radiofrequency. This has varied success, and I'd say it's not something we commonly do. It's an option, again, in the right patient selection. So in regards to procedures, improved nasal breathing can help everyone. The reality is when you breathe through your nose, you feel better. And again, there's a quality of life component to that, as well as putting your best foot forward to better treat your sleep apnea. Now in the office, think of things as stiffening, shrinking, dilating. And really the shrinking, dilating part is relating to what we do in the nose. We're getting your airway working better. From a surgical standpoint, we can remove tissue and we can straighten that septum. So again, I always talk about, I use baseball analogy, but the office-based procedure tends to be the double, the operating room tends to be the triple. Both are very good, both move the ball down the field, much better than any sort of medical management. I think the thing to also think about is that proper selection is key. So, you're an individual, you have individual goals, you have, some people come in and they just have snoring problems, some people come in and they feel tired, some people come in and they feel like their head's gonna explode daily because there's a lot of pressure. And so, the question at Advent is, what is your goal? How do we achieve that goal? How do we manage expectations and get you over the goal line, essentially. And so, certainly at Advent, we believe that options are game changers. And so each of you are unique. We need to figure out what it is that you're looking for and how to be successful in getting you there. So in conclusion, snoring and sleep apnea is extremely common. And honestly, I think it's probably underdiagnosed and undertreated. The reason for this is that the barrier to figure out if you had sleep apnea used to be you had to go to a sleep lab and people didn't have any interest in doing that. Now, with at-home sleep study testing, we can find out if this is contributing to your quality of life in a negative way. Poor awareness of treatment options. Most patients I talk to have never heard of an oral appliance, and honestly, that's a travesty. Ones that are custom made work equally as well as CPAP, and honestly, there's a lot more people out there that could be treated if they knew that option existed. At Advent, individualized options are based on individuals' personal preference. When patients ask me, hey, should I wear this CPAP machine or should I do this oral appliance, what's better? And my answer every time is, it doesn't matter to me what I think you should use. Use what you think you'll use and stick with. And that's what matters, okay? It's about what you think you'll use. If I try to push something on you that you have reservations about, the chance of you actually sticking with it is zero. And so, really, both work well, oral appliance or CPAP machine, and they both work their best if I get your nose working first. So in my mind, I need to get your nose working, then you decide what option you want after that. And so that kind of leads us to this last point. All roads lead through the nose, meaning step one is get nose working, step two then is addressing the obstruction that's beneath the nose. I can't stress that enough, and hopefully when you come to Advent, we'll help you understand why that's important. My name is Dr. Ethan Handler. So thank you again for listening and watching this webinar. Advent knows when you breathe well, you live better.